I'm a small business owner who is the president and CEO of Southeast American Financial Group, which is...
Is your speaker, is it on? Is it?
Yes, I turned it on.
Yeah.
Yeah. My company is owned and operated by my husband and I. Through the years, I have employed as many as a dozen employees and subcontractors. However, during this economic downturn, we had to reduce our staff to 1.5. The expensive cost of healthcare makes it extremely difficult for us to continue to afford, especially during this current economic crisis. Currently, I pay 50% of the monthly health insurance payment for my employee. To keep costs down, I chose an HSA, but this becomes a challenge for the employee who has a pre-existing health condition early in the year before they're able to save their deductible. And for small businesses like mine, it is very important that our employees get the health care they need so that they can proactively manage their care and be available for our business needs. Like many husbands and wives who work together, my husband and I have to purchase individual policies instead of a family policy. In 2007, the insurance coverage increased for us to $1,400 per month. To continue to carry insurance, I switched my company to a high deductible HSA policy. Now we pay $881 monthly for just both of us. However, we have to cover the first $3,000 of our expenses, and prescriptions are covered only after we exceed these deductibles. While our policies include preventative care, the insurance company almost always excludes something and sticks us with a copay. My doctor recommended a preventative procedure. I verified with my insurance company that the procedure would be covered 100%. During the procedure, the doctor discovered a minute issue and recommended 2 additions to my diet. Consequently, my health insurance company changed the preventative classification and charged me $562.50. The families of small business owners bear the brunt of the inequalities in our healthcare system that is heavily skewed in favor of big business. When I worked for a larger business, I had a more affordable family policy, which also covered my husband. Because I'm younger and healthier, our coverage was cheaper because it was issued to me as the primary. My husband had an eye emergency that resulted in a bill in excess of $80,000. The insurance company paid 25% of the street price based on its discounted arrangements with the hospital. Why is it that the hospital services have to be priced at such exorbitant sums for the cash-paying customer who, in most cases, cannot afford to pay these astronomical bills? If we could reduce those costs to reasonable amounts, individuals could then afford to pay their bills. We need affordable solutions now. I ask that you put health care back in the hands of the doctors and prevent insurance companies from dictating the care we receive. Remove the fine print and provide clarity so that we know what we're getting. Health insurance companies shouldn't be able to wiggle out of paying for healthcare services. The restrictions should be lifted as to what a doctor or hospital that you may be able to use. Allow small businesses to pool together to purchase insurance under national group umbrella policy. Provide tax credits to small business that purchase coverage. Remove the 7.5% of AGI threshold on income tax for medical expenses. Do not mandate that small business provide coverage. Remove the 75% threshold for business to cover employees before they can get coverage. Divide insurance into medical and catastrophic care. Allow tax credits to individuals for direct pay to their doctor, then they can purchase insurance coverage for surgery and other catastrophic illnesses. In conclusion, it's time to end the stranglehold health insurance companies have on American citizens. Small business owners and their employees have been forced into paying exorbitantly high premiums, risking high deductibles, and then being nickel and dimed by the insurance companies. We need to wrestle the control of our health out of the hands and put it back in the hands of individuals and doctors. Get rid of the endless administrative overhead, which is often aimed at finding ways to reject payment care. Help American small businesses to pool together to leverage our scale and bring the cost of care down. Thank you. I'm open to any questions.